My name is Dr. Yosef Wakwaya. I'm a pulmonary and critical care physician based in Dallas. Got into medicine around the end of high school. I became a pulmonary and critical care doctor because I thought that they were the smartest doctors in the hospital. Ultimately, I realized that I love the lungs, spent more and more time with individuals who had interstitial lung disease. I never gave up the general aspect of being a pulmonologist. That's one of the reasons why I'm in medicine. African Americans, we can be predisposed to having disease that might be a little bit tougher to control because of our concerns about healthcare and the trust in physicians. I get told that sometimes that this is a request for Wakwaya, and in the beginning I used to, ask why, because in my mind there's not too many unique things about me. But sometimes people want that, and I totally understand that. It's easier to trust somebody who looks a little bit more like you and where you can see resemblance of yourself in them. A lot of times, because we have lengthier interviews and interactions, a little bit of hesitancy about the trust in medicine ultimately comes out. And I think that's a great point when we're vulnerable and we're talking about what we believe or don't believe, or where they just tell me, I don't know, man. And so that gives me a chance to dive down deeper into what they are concerned about and what they're hesitant about. And there are things that come up, from our community from the past. I have to acknowledge the pain and the hurt in our community for those reasons. To develop that rapport and trust with patients, I think that there's a few key things that I try to do as a physician. One is, when we were in med school, we were taught that the average physician interrupts the patient within 18 seconds. I try to hear what they have to say. They've waited a long time for the appointment, and I often hear from patients about how other doctors will not listen. So I just sit back and I give them an unfiltered time to just tell their story and hear their complaints and let them know that, hey, I hear you, I understand what you're feeling, and that I understand that, and I'm here to support a plan to get better. I try to educate throughout the visit about the rationale for why we're doing what. So if I can bring up the new and the old CT scans that shows the changes if there's been progressions, or if we can bring up the breathing tests that we do at each visit and show, hey, your lung function has been declining, or hey, you're responding to therapy, it's going up, just to kind of reinforce what we're doing and why. I think if you understand why, then that makes it a lot easier for us to be on the same page. I talk about the risks and the benefits in kind of an organized pro-con way. And I also talk about times where maybe the benefit becomes better than the risk. For example, if we've done what's been proven to work and we're still struggling to control our disease, then sometimes we have to talk about transplant and other bigger issues that we might want to avert or stay away from. And that might be the time where the benefit of a clinical trial becomes increasingly more popular of an idea with patients. There's obviously a more limited access to good doctors and to adequate health insurance within our community. And so without having a pulmonologist to follow with longitudinally, there can be times where the disease can progress, and you might not always feel it. We're built with extra lung tissue, so unless you're following up with a lung doctor closely to look for that, you might not feel it. And then I have people who come back to me with either autoimmune disease or sarcoidosis, and things have gotten sicker in the interim. So that's one way. I meet multiple patients who are very hesitant to start the medication that we would recommend to it. I've also seen a more recent kind of theme emerging, which a lot of people of color are wanting to try low inflammatory diets or alternatives to taking the medication. And that often gets brought up at kind of like the end of the visit. And I think that from a physician side, eating a well-balanced diet full of vegetables and fruits of different colors and also having regular exercise is implied. And I think they think that we don't mention it and that we might be withholding a treatment or an option, and that I would prefer to push medication. While I do agree with eating healthy and exercising, by the time I'm recommending the medication, it's because those alone won't be enough to control the disease. There are so many things that are crucial for maintaining lung health. One of the things that we need to do is continue to follow up with your lung doctor on a regular basis. Sometimes our lung disease can be progressing or changing without us feeling it. Another thing that's very important is protecting the lungs that you have. Staying up to date with vaccines, particularly for patients who are immunosuppressed. I think it's also important to know that while medicine does have a past that's concerning, medicine is trying, and we are trying to get better. And every lung doctor I've met is trying to advance the field for all, They realize that now everyone's included.